Hi, this is Christina. I'm one of the creators of Table Rounds, and I'm excited to share with you our episode 2 of Voices of Table Round, which is our audio-based project that showcases creativity and learning medicine through collaboration. Let's see what we can teach each other about the connections between obstructive sleep apnea and stenosis.
Hi, this is Claire Lachman. I'm an M2 at Liberty College of Medicine, and one of the first things that popped into my head from the connection between obstructive sleep apnea and stenosis was obstructive sleep apnea and its link to insulin resistance. As we know, insulin resistance can lead to a higher likelihood of developing the chronic disease state diabetes mellitus type 2, which leads to increased dyslipidemia, ultimately causing widespread macrovasculature atherosclerosis.
Hello, my name is Bart Ballen. I'm a fourth-year medical student at Virginia Commonwealth University School of Medicine, and my connection between obstructive sleep apnea and stenosis is a condition called laryngomalacia, where redundant tissue above the vocal folds causes inspiratory collapse of the epiglottis and arytenoid cartilages, causing stenosis of the airway and obstructive sleep apnea type symptoms in infants. Typically, this is self-resolving, but in 20% of the cases, this requires surgical correction through supraglottoplasty.
My name is Sarah Beaverson, and I'm an M2 student at VCU School of Medicine. When I think about obstructive sleep apnea, I think about how it is one of the causes of pulmonary hypertension. Pulmonary hypertension is when the blood pressure in the arteries of the lung become high due to narrowing of the vessels, which strains the right ventricle and could lead to right heart failure. This makes me think about other causes of right heart failure, such as pulmonary stenosis. In pulmonary stenosis, the pulmonic valve becomes stiff and the right ventricle has to pump harder to force blood into the pulmonary artery. This can cause the heart to become weak and stiff, leading to right heart failure, which can present as swelling of the legs, fatigue, and shortness of breath.
Hi, my name is Marcelo Santos. I'm a medical student from Brazil. For this connection, I think about how untreated obstructive sleep apnea increases the risk of atherosclerotic vascular diseases through a lot of different mechanisms, as oxidative stress as a result of intermittent hypoxia, vascular inflammation, endothelial dysfunction, and other factors, and because of that, it increases the risk of carotid stenosis.
My name is Yamada, and I'm a fourth-year medical student at Virginia Commonwealth University. When I think about the association between obstructive sleep apnea and stenosis, I think of adenotonsillar hypertrophy leading to stenosis of the airway. The adenoids in the tonsils are collections of lymphoid tissue in the nasopharynx, and these can become enlarged due to inflammation, infection, or other genetic factors.
Hi, this is hastily masayasana. I'm a third-year medical student at VCU School of Medicine in Richmond, Virginia. My connection between obstructive sleep apnea and stenosis is the craniofacial conditions such as tonsillar hypertrophy or an elongated or enlarged uvula that narrow the upper airway and contribute to the development of obstructive sleep apnea. The Mallampati classification is used to quantify airway narrowing. Class 3 and 4 are considered positive for airway narrowing and correlate with obstructive sleep apnea severity.
This is Nora Rosenberg. I'm an MS4 in New York City, going through internal medicine. When I think about OSA and stenosis, one of the first things that comes to mind is resistant hypertension. OSA is a common cause of resistant hypertension in the US, but other etiologies include aortic coarctation and renal artery stenosis. In fact, OSA and renal artery stenosis are both potential etiologies of chronic kidney disease due to reduced perfusion.
My name is Eleanor Love, and I'm a medical student at Virginia Commonwealth University in Richmond, Virginia. Patients with obesity are more likely to experience both obstructive sleep apnea and atherosclerotic stenosis of multiple blood vessels, such as the coronary arteries and/or the carotid arteries. When considering the relationship between OSA and stenosis, I think of obesity as a common risk factor that is often present in both conditions.
As you can see, there are many different connections that can be created from the same two cards. And even if you come up with the same concept as someone else, there's a nuance in what you end up learning. If you can think of other ways to connect obstructive sleep apnea and stenosis, we'd love to hear from you. Thanks for listening, and stay tuned for our next episode.